right, so I'm here with Dr. Jin. You had previously had a very successful career in academics. Now you're out in private practice and you focus primarily on rhinoplasty, right? In your day-to-day life, when you're going to work and you're preparing to do noses, or you're talking to patients about noses, I mean, do you have a general approach to them, a certain philosophy as far as rhinoplasty is concerned?
I personally believe that the purpose of rhinoplasty is making the nose go away. When you see somebody, usually they see the eyes, the balance of the face, the texture, skin textures, or the atmosphere, but they really don't focus on the nose. The only moment the nose is noted is something is wrong with the nose, like a crooked, deviated, tip is too large, bulbous, upturned, short.
Sure.
So what I pursue is making the nose go away when you see somebody. I like to make the nose very natural, not prominent, a well-functioning nose. Just blends with the patient's face. That's my rhinoplasty philosophy.
If you read websites in Chinese, they'll refer to rhinoplasties of a certain type being like Korean style. In Thailand in particular, in China, I noticed these really just wildly augmented noses. Either the patient is trying to mimic something that they see in the media,
right,
or the surgeon is trying to mimic something that they saw at a meeting. To me, it's the opposite of what you just described. They make the nose
right,
the feature of the face.
That is the current trend, but I object those ideas. I mean, the subway in Korea, you can see a lot of advertisement of plastic surgery clinic, and all the models there look almost the same.
Yeah.
I mean, the nose is too high, pinched, the forehead is a little bulbous, the chin is chopped up. They look almost the same. That's not the right thing to do. I mean, China, Thailand may follow the Korean trend, but I think the Korean trend is going wrong. I have seen lots of patients who suffer from those unnatural looking, too operated rhinoplasty by silicone alloplast. Those make the patients feel better at the moment, but for a long time it makes problems, like pressure on the nose, tip is painful, too stiff, Pinocchio style nose, Abata style nose, the alloplast pops out, infections, a lot of complications. So I don't want that kind of nose.
So in general, you're going for a nose that looks natural, is not the main...
Still beautiful.
Still beautiful,
yeah,
but not the main feature of the face.
Right.
And for the most part, you're using autologous material from the patient. So.
Right. First of all, I like to say the most common patient that comes to me is for removing the silicone. It can be due to pain or pressure sense on the dorsum, infections, skin redness, or it can be an upturned nose due to scalp contracture. So a lot of reasons, tons of reasons to remove the silicone implant, and they come to me for removal. But the choices that they can have are one of three. Number one, removing only. She doesn't care about the shape, she just wants to remove this thing because of infection, whatever. And number two, remove the silicone implant or Gore-Tex implant and restore her or his original nose. Not a high nose, not a high tip. They just want to go back to the original nose before surgery. And number three, they love the nose height, nose shape, but it causes problems like infections. Because their original nose was so low, and the tip was so low, they love the current shape, but it causes problem because of the alloplast implant. They were accustomed to the change the nose for a long time, and now they have to remove the silicone, and they just don't want to go back to the original nose. The option is replacing the silicone or Gore-Tex implant into autogenous materials and make the look same or even better. So those are the three scenarios the patient can choose. This is one patient that came to me because of the silicone complication.
Okay.
And you can see that it's deviated to the left. Nose looks crooked. She wanted option 3, as I mentioned earlier.
Okay.
Removing the silicone implant, replacing it with autogenous materials because she wanted to keep the height of the current dorsum and maintain her tip. What I did was removing the silicone, replace with a recartilage graft, and make the nose look better.
So you did that all at the same time?
Yes.
In a situation where it's infected, obviously you're going to wait.
Right. You know what? Actually, it's not.
Really?
Even infected, you can do it at once. That's interesting, right? A lot of surgeons says if you are infected, I mean your aloplasty infected, and your pus is coming out from the nose, then you say, patient, take it out, let the infection go away, wait 6 months, and then I'll take care of your nose again.
Okay.
But for the patient's part, then I have to do the surgery again. Takes double money, takes time. I mean, leg time is longer than simultaneous operation. But I found out that doing those things together is pretty safe. For example, even the nose is infected, you take out, clean it. Sometimes you should do some debridement, infected tissue removal, take out the rib, carve it, put it in, drape. It's usually safe and the patient is really satisfied. I will show you some examples. I will show you one infection case. So this is another one.
Oh, wow.
Her nose is upturned.
Okay.
She's 67 though, so she's a very active woman.
I see.
She wants to socialize. She wants to meet friends. She wants to travel, but this nose makes her unhappy.
It's very obvious.
Very obvious.
Yeah.
So she decided to have an operation, and there is a silicone implant here, and she wanted to fix it. So I took it out. Even though she was 67, her rib cartilage was pretty good. So I replaced it with a rib cartilage. As you can see, the height is maintained, but the tip is much lower.
Yeah.
She's very happy about this result.
The columella,
Yeah.
was there any additional soft tissue graft that you put in there?
Oh, at the tip, at the columella,
Uh-huh.
I put some rib cartilage perichondrium.
Okay. What about the length of the columella itself?
At the tip, I put some perichondrium, but here, no.
Okay.
This is cartilage.
Okay.
So tip is a little stiff, but it's trade off if you want to make the tip longer.
Okay.
This case is a primary case.
Okay.
She has a deviated nose, obviously, from the frontal view.
To her right, I guess.
To her
Okay.
right,
All
yeah. The bony vault is deviated to her right. And also she has a little hump with a little tip ptosis,
Okay.
right? Also she has a nasal obstruction because of the crooked septum. So I did an open approach, settled down the septum, corrected the middle vault, and the deviated bone was corrected by osteotomy. And probably I did some spread grafts bilaterally. And tip has been slightly upturned by sutures and grafts. The hump here has been rasped very mildly using rasp and cut.
And just so a patient understands, when you take down that hump kind of gently and you raise the tip,
Yeah.
you're sort of uniting the two to help make a
It's
straight
making a
line.
balance, not just chopping the hump, because most Asian people have a low profile, even though they may have a hump. Tip is a little tall tip, so chopping out the hump is not a solution. You have to harmonize the lateral view by elevating the tip a little bit, raising the radix a little bit, but lowering the hump very mildly.
Yeah.
And finally, it becomes very smooth.
Okay. I can appreciate that. Yeah, partly because of limitations of my own skill set and just the way I like to look at noses. When I do them, it's a bit of a radix graft. Even if in my patient population, I'm almost never making a very high bridge. So, but that's a very good
So
example.
most Asians want a minor change. I mean, I believe they want a change, definitely a change, but not, sticking out too much. Keeping their ethnicity. Even people living in United States, Asian people, wants to maintain their ethnicity even though they want an improvement.
Sure.
So, with the improvement, keeping the ethnicity is the main goal. Not radically changing into Caucasian style nose.
Yeah.
That's a nonsense.
That is nonsense. I had a slide at one of my talks. This was somewhere in the U.S. I can't remember where, but I was talking about the term westernization
Westernization,
for the
yeah.
eyes. I said this term should never be used again, and I told a story from just that morning. Some plastic surgeon from Philadelphia was asking about my lecture, and I was like, "Oh, this is it." And I was showing it to her, and she's like, "Oh, they're wanting their eyes to look more Caucasian," which is an upsetting comment for me to hear. And I included not her, but her comments in the lecture, and I had this slide already made about the westernization procedure, and then there was a funny slide after it that said something about the caucasity, like the attitude of the Western world, thinking that their ideas about beauty is adopted by the rest of the world or the Asian world.
Right.
And I saw that plastic surgeon get up and walk out.
Walk out.
She left. I don't think she thought that was very funny, and I don't think she appreciated me including that in the story. But maintaining ethnic identity and
it's
individuality
same.
as much as
The
anything.
Caucasian people have a prominent forehead, deep-seated eyes, prominent bony structures, and the nose is just prominent. But the Asian face is like a two-dimensional. I mean, just flat face, and the nose is protruding too much at the radix. It's too sticking out. It's very unnatural.
Yeah, when patients make that comment that they want their bridge very high from the from the glabella all the way down, I tell them, you're going to look like a Star Trek character. You're going to look like one
Avatar.
of the, you're going to look like Avatar or some character from the Star Wars film. But in any case, I appreciate you taking the time to talk to me and go over a few cases. And
I love.
great pleasure chatting. Yeah, great. All right, thank you. Yeah, thank you.